Safe Seniors, Wise on STIs is an intervention program to educate people ages 55 years and above on safe sex practices. As some of you may know, most of the intervention programs that aim to increase safe sex practices are targeted towards teenagers. Yet the senior population remains an area that needs to be further addressed with concern to safe sex practices due to the fact that the number of people over the age of 50 are contracting STIs very rapidly.
The goal of our study is to spread awareness among men and women in San Diego ages 55 and up. We will be recruiting 100 participants from one single senior living facility. The intervention will include a 6-week educational program. Classes will be approximately 2 hours long and led by a trained health educator. A baseline survey will be distributed to all participants as well as a post-intervention survey.
The first objective of our study is that post-intervention, participants will have a 15% increase in sexual health knowledge. An evaluation question is, what are the signs and symptoms of a sexually transmitted disease in a man? The second objective of our study is that post-intervention, 50% of participants will indicate that they are very confident in being able to use a condom. An evaluation question is, how comfortable are you wearing a condom before intercourse? Our third objective is that post-intervention, 75% of participants will feel very comfortable making an appointment to see a physician and attend the consult. An evaluation question for this objective is, how comfortable do you feel scheduling a doctor's appointment for an STI screening? Our last objective is post-intervention, 50% of seniors will report being very likely to practice safe sex in their future sexual experiences. An evaluation question is, do you insist on condom use when you have sexual intercourse?
Safe Sex for Seniors, Wise on STIs, we decided to apply the health belief model. Therefore, we will take into account perceived benefits of protection from STIs, as well as perceived barriers of practicing safe sex in order to change seniors' behaviors and induce them into practicing safe sex.
Our research design is non-experimental. Our educational program will only be conducted at one senior living facility. Due to the limited resources and a small sample size, there will be no random assignment, but rather convenient sampling since participants are selected because of their accessibility and proximity, and no control group. The evaluation design will consist of a pre- and post-intervention questionnaire that will allow us to compare whether or not our objectives and goals have been met. In order to measure independent variables, Safe Sex for Seniors program will distribute a questionnaire pre- and post-intervention. The type of measurement we will use will be categorical, ordinal, nominal, and continuous, which will help with the analysis of our intervention. The main independent variables include income, education, and gender. The main dependent variables we will be analyzing are knowledge, STI prevalence and incidence, beliefs and awareness, increase in STI screenings among participants, and incorporating sex methods in everyday life.
Seniors, Wise on STIs, explored whether there is an association between increased knowledge and behavior scores obtained through the sexual educational program surveys. The sexual practices were assessed by participants self-reporting on their sexual practices, as well as through completed questionnaires that asked about knowledge and behavior. If participants scored 14 out of 20, or 70%, on questions associated with knowledge, guidelines were considered to have been met. If a participant scored 14 out of 20, or 70% on the behavior questions, guidelines were also considered to have been met. For the statistical analysis, we first looked at the univariate association. This is the way we obtained the main predictors of interest, which included both knowledge and behavior. We then looked at the bivariate associations, which were unadjusted associations between two outcomes, the meeting knowledge and behavior guidelines, and the independent variables, which were education, gender, marital status, and income. Whichever variable was significant from the bivariate analysis, that was then included in the logistic regression model. The logistic regression analysis includes adjusted association between the outcome and the main predictor or variables of interest.
Objective number 1 was met with a 70% increase in sexual health knowledge. Objective number 2 was also met with 59% of participants feeling very confident in being able to use a condom post-intervention. Objective number 3 was also met with 75% of participants feeling very comfortable making an appointment to see a physician and attend the consult post-intervention. Finally, objective number 4 was not met with only 7% of participants reporting to be very likely to practice safe sex in the future.
These are the results of bivariate regression and logistic regression associations, unadjusted and adjusted, both presented to you in corresponding tables of pre and post intervention. Our program was very successful, being that we saw both a change in behavior and knowledge from T1 to T2.
We were only able to reach out to a single senior facility. The limitation of a small sample size presented itself in our program. Accommodation of certain impairments that come along with old age was another limitation we came across and will always be a limitation to a study dealing with the elderly. For example, some seniors may not be able to hear clearly what is being taught. Self-reporting is always a limitation to consider with questionnaires and surveys. Sickness and death of participants must be considered when dealing with live participants, especially in elderly population.
Despite the limitations of our program, we were able to spread good education to many seniors in San Diego. In conclusion, Safe Sex for Seniors Wise on STIs met objectives 1, 2, and 3 and did not meet objective number 4. Through our educational program, we were able to enable seniors to become better educated about STIs, improve seniors' confidence to practice safe sex, increase seniors' comfortability when handling their sexual health, and set a standard for future safe sex practices.